can you say more about the differences and similarities between hospice and palliative care?
Well, I addressed that a couple questions ago. So again, Powdercare is the big bubble. No, you can, just consider it around suffering and quality of life. And you can qualify for palliative care anytime along the way, and any time along the way of the course of serious illness. Serious illness is the phrase we use in the field because, what constitutes serious illness? It's a good question. All this stuff is very subjective and a little bit vague and loosey-goosey to try to sort of capture everybody. It's that framing is important though. So for example, if you're suffering from a broken arm, you're not going to really need palliative care. You may be suffering, but your arm's going to heal. What you need is a cast, and you need some pain meds, and you need some patience. So that's serious illness. Don't overthink that. If someone's dealing with illness, chronic, ongoing illness, and struggling, they're relevant to palliative care, period, end of story. The trouble really is finding palliative care programs. It's underdeveloped, underfunded, under-resourced as a field within the healthcare system. That's changing. There are some really smart, wonderful people before me working very hard on all that. So it's on ascent, it's coming. But anyway, the big point there is just about anybody dealing with chronic illness or serious illness is welcome in palliative care. To make that point even further, I've had patients that I've seen for 10, 12 years, obviously, so not hospice mentality, not at the end of life at all. Some of those patients are even in remission, but they're struggling with their identity around illness, even if they don't even have that illness anymore. They left life to go battle with cancer. They won that battle and have to re-enter the world, and that can be really, really difficult. And those guys are palliative care patients. So just to make the point of how broad that field can be. And then again, remember, hospice is a type of palliative care subset reserved for the final months of life. And I'll say it again here too, that part of the problem that gets confusing, palliative care is not an insurance designation per se. It's a type of care, yes, and it's a field, an official subspecialty in medicine, yes, but it's not an insurance designation like hospice is. When someone says someone's on hospice, they really mean they're on the hospice benefit. So that's where it also gets a little confusing, is that hospice is defined by the insurance industry, by Medicare and the insurance industry. And that can be very confusing to people, whereas palliative care is not defined per se by the insurance industry. So anyway, there's just a reiteration. We can't make those points stridently enough. They get confusing as hell. But maybe I'll add one little more point of color on this. In the field of palliative care, and by the way, as a professional in the field is called hospice and palliative medicine. Since 2006, that is the official medical subspecialty with all this training and requirements and testing requirements, et cetera. So my training, I've done work in hospice, I've done work in sort of upstream palliative care. It's all the same training. It's much the same work. It's these structures that are different. So that's one point. And lastly, I'll simply say here too, one of the challenges for the field is we know we're not going to be able to spit out enough subspecialists to do this work to meet the demand now or in the future. So one of the things that's happening in palliative care, and this gets at someone's question earlier about being an educator here, is what we're trying to do in so many ways, palliative care is just good healthcare, is good care. We should expect even our healthcare system to care about our suffering, our experience of illness. We should expect the health system to be concerted around our families, the impact on our families as well. But the truth is we can't rely on our health system to do that just yet. So we need this subspecialty to kind of reorient the rest of healthcare back to its fundamental basic responsibilities. So in some ways, the most important patient in palliative care is the healthcare system itself. And so one of the ways you see that played out is a lot of us in the field are trying to open and develop this thing called primary palliative care, which is you don't have to be a subspecialist to do this work on some level. You don't have to get all this extra training. You have to have time and some skills around communication and caring and eking out someone's pain and suffering and tending to it and not running away, etc. But it's pretty basic stuff on some level. So we're trying to drive palliative care training deeper into medical school curricula, nursing school, social work, chaplaincy curricula, so that in the future, the hope would be that any doctor that you've come across or nurse who's been trained in the last however many years, you can expect them to have some basic facility around palliative care principles. And we call that primary palliative care, where we don't need the specialist to come in and save the day. That's happening. It's a slow boat. We'll see how far we can go, but that's happening too. So anyway, there's a little bit more detail on this big question.